Hi, I'm Mayor Tim Balderman, and I'd like to welcome you to this edition of Community Business Spotlight. Joining me today is Dr. Doug Prince, orthodontist. Doctor, how are you?
I'm great. Thank you for inviting me.
Absolutely. Tell us a little bit about your business.
Yes, I practice in New Lenox across from Lincoln Way High School on Schoolhouse Road and Route 30. Been there about 9 years. 8 years maybe, and it's a great community. The reason I came here is because I have an office in Orland Park. A lot of patients are coming from Orland Park there, and of course they would take an hour to get there and they'd have to park and so on. So I made arrangements with Dr. Mitzos to use her office periodically so the patients didn't have to drive, and they say, now I can walk to you. You know, it saves the patients a lot of time, money, and effort, and it helps us as well. So
sure, absolutely. Yeah. Now, an orthodontist, there's much more to it than a layman would know. Tell me what kind of services you provide for your patients.
We're a specialist regarding treating Invisalign and regular braces. We straighten teeth, help the jaws to grow the right way in developing children, and help get the arch shape in the face so that it balances. A lot of times people that have malocclusions or the fact that jaws don't grow right, the teeth are real crooked, they don't feel good about themselves because they don't look good. So if you're able to change the way a person looks and change the face, which you can, and change the arch shape or the jaw shape and size to match the face as the patient grows, it changes the whole aspect of how they feel about themselves.
Absolutely, and a person's mental health is extremely important to their physical health as well, no doubt about that.
It is. We have patients who come in that won't smile and hold their head down because they're embarrassed about themselves. Once we get done, it's wonderful because you get to see the personality change from being embarrassed to being beautiful.
Sure.
So it's a great profession.
That's great.
Yeah.
Now, your profession, how long have you been an orthodontist?
30 years.
30 years, and I imagine that you've seen major changes in your profession over those 30 years.
Major changes, yes.
What do you see happening now? What trends do you see happening now in your profession?
Now what's happening is Invisalign has come up with a program where you can do braces with clear plastic aligners. And it's designed in such a way you take an impression, which is an impression of the mouth like this.
Sure.
And then you send it to Invisalign. I write a prescription. They then move the teeth exactly the way I want them to be. And then you have a series of aligners that moves the teeth from where they are crooked to straight, 1/4 millimeter per aligner. And they just take them, you wear them all the time. You can't see them, and it snaps onto the teeth, and then you take them out to eat and put them right back on again. So you don't have broken brackets, you don't have bad oral hygiene, you don't have food caught around them, and you can eat anything you want. When kids have braces, they eat what they're not supposed to,
sure,
knock the brackets out. But Invisalign, you take them out and put them right back in again. So this is the biggest trend. Invisalign I'm the #1 orthodontist in the state of Illinois with regard to teen Invisalign.
Wow.
And I'm in the top 10 of 40,000 practitioners who do regular Invisalign. I've been doing it for 11 years now.
Wow, that's amazing.
And it's a great, it's a difficult process to learn how to do, but once you learn how, it's spectacular.
So you're an expert in the field. We're fortunate to have you here in the community, someone at the top of their profession there.
Yeah.
You've got some examples of what you're talking about. Can you show us those and tell us exactly what's going on here?
This is a patient that came in. They told him he had to have surgery on his jaw to get the teeth corrected. This is what his teeth looked like before we started, and this is the way the teeth looked like. Put this right here. Afterward. So we changed the shape of the jaw, took someone who couldn't smile and gave him a beautiful smile and straightened his teeth. And this was done with Invisalign. So he's a happy camper.
So without the surgery?
Without the surgery, correct.
That's amazing. Yeah. And I noticed he also got rid of the mustache, which helped too.
Yeah.
So that was
well, the mustache is a diversion, so you don't look at his teeth.
Well, but that's true.
It is true.
Absolutely, no doubt about it.
Right.
Oh, that's amazing. So, here's somebody that would have gone in for oral surgery, perhaps, or done nothing.
He was 40 years old.
Wow.
And he just didn't want to do the surgery. And he came in and he says, I've been told Invisalign won't work for me and so on. But it's true if you haven't had a lot of experience. In every profession, if you don't have the experience, you can't get to the level you need to be. And I'm not tooting my own horn, I'm just saying it took me 10 years to get there.
Oh, well,
Yeah.
but that's why you're here. We need you to toot your horn,
toot my
because
horn.
we want the people in the community to know
right.
that we do have experts in the field that are here in our own town.
Right.
So
this is teen Invisalign, if I can.
Sure, absolutely.
Okay. This is teen Invisalign. She was 16. She had a huge overjet where the teeth, she couldn't get her lips together, and she had a severe deep bite overlap in the front. This is before and after. This is the picture of the teeth here when they were, I got that the right way.
Here's the before.
This is the
here's
before.
after, sure.
This is the after. So we closed the space, moved the teeth back, and changed her whole profile. This is how far out the teeth were when we started, and this is where we moved them back to after, which is about ½ an inch. This was all done with Invisalign as well.
Now, how long does this process take from start to finish, from the before to get to the after result?
She had them on 16 months.
16 months,
16
that's
months.
all.
Yep. And the interesting thing is she was a spectacular patient, because again, when you have this much of a discrepancy, the lower jaw is way too short and the upper teeth way out. The old traditional method was you do surgery on the lower jaw, move it forward, and then move the upper teeth back with braces. Now, with the way that Invisalign can design the treatment, you can do it with braces too. You don't have to do all of that. So she had been told she'd have to have surgery, so that's why she hadn't done anything for 4 or 5 years. And they looked me up on the internet and they saw some of the before and after, and the mom came in and she said this girl was doing terrible in school, was not progressing well, and after we straightened her teeth, her whole image changed about herself.
Sure.
And she was now a straight A student. It was, mom came in with big tears in her eyes.
Sure.
It was wonderful, yeah.
Oh, and imagine it makes a huge difference on someone's psyche, you know.
It does.
And yeah, that is, especially in younger adults.
In younger
like
people,
that. There's no doubt about it. So, do you think that this process, this Invisalign, I mean, how many people do you see, what percentage you say, yes, I think this would work for you, or no, you do have to go the traditional route of surgery?
When I first started, about 50-50.
Okay.
Now, there isn't a patient, I don't think, that I cannot treat with Invisalign.
Wow.
You know, and so if this young man here had Invisalign to correct that kind of problem, that's more severe than most. That's why I brought these. So you can treat almost every case with Invisalign. If there's a severe deficient mandible where the mandible is just not growing and they're already 20, you end up having to do surgery on the lower jaw and move it forward. But this girl was able to grow and to get the arrangement of the teeth and jaws right without any of that.
I mean, that to me is just absolutely amazing.
Yeah.
That would have been a very painful and long process of surgery is now corrected just with Invisalign.
With Invisalign, exactly.
That is really something.
It is. And the nice thing is that the kids, it's like you're not wearing braces. And you can eat anything you want, and then what happens is pretty soon the kids around them, this girl told me that, her name is Sarah, she said, all of a sudden people noticed I was changing. And she said it made me feel so good, because you can't see you're doing anything. It's so slow. It takes month to month to month the change, and all of a sudden people recognize it.
Fantastic. Well, you've talked about a great service that you provided, and again, I think it is very impressive that you're at the top of your game there. Something that's so valuable to our people. Anything else you'd want the people in New Lenox to know about your business?
I think that what people should do always with regard to orthodontics is get a second opinion. There's 2 or 3 different things that can be done, methods and treatment modalities and so on, and the more that a patient gets information, the more they can make the proper choice for their children or for themselves. A lot of times they'll go in and get one opinion, and if you've been doing the same thing 20 years ago, it's different than today. So the best advice you can do is get 1 or more opinions for sure, beyond the one you got.
Well, Dr. Prince, I want to thank you for being here, and I certainly am glad that you're here in the community providing these great services for our people, and best of luck to you in the future.
Well, thank you for having me. I appreciate it. From my perspective, this is the most rewarding profession there is.
Absolutely.
Changing people's lives.
No doubt about it. Thank you very much.
Well, thank you for inviting me. I appreciate it.
Absolutely.
Okay.
And I want to thank each and every one of you for watching this edition of Community Business Spotlight.